In a clinical setting, you may encounter a patient exhibiting profound trauma responses, acute hypervigilance, night terrors, and a severe inability to regulate stress, without ever encountering a proximate traumatic event in their own lifetime. We see this exact presentation in what we categorize as Generation 4 patients, to minor unrecorded childhood stressors. A statistical anomaly emerges when you look at the patient's siblings. When multiple children raised in the same household develop identical, highly specific configurations of panic and boundary failure, the mathematical probability of spontaneous individual pathology approaches zero. These symptoms serve as downstream behavioral markers, indicating the presence of a deeply concealed multi-generational trauma network operating beneath the surface of the family structure. This schematic shows a 4-generation family structure. To understand the present dysfunction at the bottom, Generation 4, we use a forensic reverse analytical model, working backward from observable distress to deduce the original cause. Observing behavior is only the first step. A precise reconstruction requires mapping the exact biological and structural vectors that push anxiety upward through the family tree, from parents to children. To isolate the origins of this specific clinical profile, we have to trace its architecture back 90 years, mapping a transmission pathway known as the Derna Trauma Model. The Derna Trauma Model suggests that the psychological reality of the descendant remains inextricable from the unacknowledged history of the ancestor, a connection we must now forensically reconstruct. The boundary confusion seen in Generation 4 is absorbed directly from their parents in Generation 3, who operate at a baseline state of severe hypervigilance. Clinical data for Generation 3 reveals classic PTSD indicators. They experience persistent hyperarousal, abrupt panic awakenings, and a specific somatic aversion to physical contact. This models the HPA axis. Extreme trauma alters this loop, preventing cortisol from shutting down the threat response. Genetically, trauma hyper-methylates the NR3C1 gene, decreasing glucocorticoid receptors. Simultaneously, FKBP5 hypomethylation overproduces blocking proteins, creating total glucocorticoid resistance. The system permanently locks in high alert. Generation 3 is biologically trapped. Unable to chemically reset, their internal terror dictates the household. For Generation 4, this chronic alarm is the only normal. If Generation 3 sustained trauma severe enough to alter their epigenetic markers, how did it occur without triggering clinical intervention or community disclosure? The answer lies one step further up the lineage, with Generation 2. They were the architects of what clinicians term the Narcissistic Family System. In the aftermath of collective trauma, parents stripped of their agency transformed the domestic sphere into a microcosm of totalitarian control, demanding absolute compliance. This environment enforces a rigid conspiracy of silence. Betrayal trauma theory outlines how children must cognitively suppress their own abuse to maintain life-saving attachments. In the Middle East and North Africa, conservative honor-shame dynamics amplify this silence. Cultural codes dictate individual suffering remains hidden to protect the family's reputation. Generation 2 constructed and maintained an impenetrable architecture of concealment, ensuring the trauma remained completely invisible to the outside world and permanently unresolved. Surviving the totalitarian pressure of Generation 2 required Generation 3 siblings to adapt. They fractured into highly specialized, divergent functional roles to manage household anxiety. The first adaptation is the freezer. This sibling adopts rigid hyper-control and emotional numbness, meticulously managing their environment to prevent sudden disruptions or systemic chaos. The Re-enactor exhibits dysregulated discharge, acting out through delinquency or addiction. They externalize hidden pain, becoming a visible lightning rod for the household's tension. The third adaptation is the stabilizer. They utilize compensatory overachievement and extreme perfectionism, building a flawless public facade to mask the family's underlying shame. These radically differing behaviors represent a coordinated, systemic distribution of labor, a survival strategy designed to manage the shared, unspoken terror of the household. We can trace Generation 2's totalitarian control tactics and obsession with survival back to the historical origin trauma experienced by Generation 1. Between 1929 and 1934, the fascist colonial regime of Benito Mussolini engineered a deliberate atrocity ecology in the Cyrenaica region of eastern Libya. Under General Rodolfo Graziani, a military forcibly marched 110,000 civilians into concentration camps, utilizing starvation and public executions to break the population. Generation 1 children witnessed mass violence in a pre-symbolic state. Before they could articulate mass death, physiological terror was permanently encoded into their nervous systems. The colonial state's reduction of the population to non-subjects provided the exact psychological blueprint for the identity erasure Generation 2 inflicted upon their children. Classical transgenerational theory relies on the reset period. This sustained era of socio-political safety allows a traumatized population to process grief and heal across generations. This graph maps collective trauma load. In post-World War II Germany, following a rupture, decades of peace created a definitive reset. Trauma spikes once, then steadily attenuates. But in the Derna Trauma Model, the reset never arrives. The curve spikes cumulatively upward at key historical markers. The first interruption occurred when Generation 2 came of age. Instead of peace, they faced decades of post-colonial authoritarian rule, extreme political repression, and surveillance. The second interruption hit Generation 3. Any attempt to build a stable life was dismantled by the 2011 revolution, protracted civil war, and urban insurgency. Generation 4, a cohort already inheriting a biologically dysregulated stress response, now faces the 2023 Derna floods, a catastrophic natural disaster compounded by infrastructure collapse. When a society is denied a reset period, collective trauma accelerates, layering biological hyperarousal and sociological secrecy into a denser, volatile compound with each generation. The severe anxiety and boundary failures observed in Generation 4 today are the direct outcomes of a 1929 origin trauma, compounded by 90 years of historical ruptures. Familial and cultural silence functions as the active engine driving trauma transmission, allowing the legacy of the past to propagate through the lineage. When trauma is forced into the underworld of secrecy, it bypasses cognitive processing entirely. The trauma cannot be spoken of, mourned, or resolved, ensuring it is passed down purely as physiological terror and rigid behavioral defenses. Secrecy ensures the trauma replicates flawlessly, preserving the patriarchal system's reputation at the direct cost of the descendants' sanity. Effectively treating intergenerational trauma requires abandoning the clinical myopia of individual pathology to treat the entire family system. The foundational step in breaking this cycle is establishing a safe base for the patient. Therapy must provide the reset period that external history denied to their entire lineage. Interventions must actively deconstruct the architecture of secrecy by confronting the honor-shame paradigms through culturally sensitive therapeutic frameworks. Integrating the historical narrative allows clinicians to bring the origin trauma out of the cultural underworld and into a space of conscious, collective mourning. We cannot cure the psychological reality of the descendant without first exposing and dismantling the architecture of the ancestor's survival.